complicated cases where IL dislocation, it's very important. And there may be many such conditions in your daily practice which may need few extra minutes of your chair time. So like conditions like trauma, posterior polar cataracts, zonular weaknesses, pseudoexfoliations, posterior capsular ruptures, and even the slightest of the IL dislocation or the tilt may induce higher order aberrations, which this can be identified on the aberrometry very clearly, where it demarcates that the problem is not in the cornea, it's in the internal area, that is the lenticular part, which is causing all the blurry double vision, glare, halos. This was one such case which came with a 6/6 vision with a -2 cylinder and was showing a whole lot of blurry vision, glare, halos problem. On aberrometry, we identified it to be an internal error. It looked centered, but it was just tilted. So here, when you counsel the patient, when you talk to them, it enables them to understand that what is their situation, how they can plan their treatment. It helps them, it empowers them to take better informed decisions for themselves. And at the same time, it will help them set very realistic expectations about the outcome, about the recovery period, what are the potential risks. And talking to the patient will definitely foster trust between the doctor and the patient. So talking, counseling them before any such complicated situation is very, very important. This also increases the compliance of the patient to your treatment. When you counsel such patients, your approach should be very empathetic. You should listen to them very actively, answer their all questions, validate their concerns, and keep reassuring them about all the concerns that they present to you. And that builds a very good environment between the doctor and the patient. You have to explain to them the condition, the causes, what are the treatment options for them. And for this counseling, you better can use the help of visual aids, like understanding them the anatomy, how the thing has happened, where is the problem. And you can give them literature, written materials, which will help them understand and take the decision. When you discuss the treatment options for them, it can be either conservative treatment if the symptoms are very minimal and the visual acuity is preserved, and you can just keep them on regular follow-ups and ask them to keep following with you in case the problems increase, then it may require surgical option. In surgical options, you can plan a IOL repositioning if the IOL is not very much dislocated, and you can just correct the position of it. But in certain cases, you also need IOL exchange. So you need to explain them that was the problem, where is the problem, there was this capsular defects, and we need to, this IOL will not work for them, and we need to either change it to 3-piece IOLs, iris fixated IOLs, or the scleral fixated ones. This was very interesting case. Sometimes the IOL gets decentered so minimally, which I just showed back. It was very minimally decentered. It was not being identified on the slit lamp that where the problem lied. So here the aberrometry helped him. When we checked on the eye tracy, there was a clear demarcation that cornea abrasions were very minimal on the lower map, and the main abrasions were on the internal map. Internal map shows the lenticular part mainly. So the abrasions lie there, and eye tracy has got a very nice toric assessment plan, which showed that if you see on the toric data, the corneal power is just 0.75. So there is no astigmatism on the cornea, therefore the toric was not planned for the patient. It was a simple monofocal lens plan, and the patient was accepting a -2, 2.5 cylinder something. And on the toric lens power, you could see that it is showing a 2 cylinder. So once it is a monofocal lens, how it is showing a 2 cylinder? So there we identified that it is a tilt and not the decentration. So, and the IOL was rotated, capsular fibrosis was relieved, and he was doing very fine. So you have to explain them the risk about infection, all the retinal detachments, glaucoma, corneal edema, repeated dislocation in the future. There can be some residual correction, astigmatism, and the recovery may take a little long. But at the same time, also empower them, tell them the benefit of the repeat procedure, that it will increase the visual acuity, it will reduce their symptoms, it will overall increase their quality of life. So patient education about all the post-operative care, recovery time, the restricted activity period, follow-ups has to be told to them. And intraocular lens decoration can be challenging condition for the patients, but effective counseling can definitely help them alleviate their anxiety and guide the decision making. And by providing a clear information, empathetic support, discussing the treatment options, the doctors can empower their patients and help them make informed choices. Thank you.
Thank you.
Thank you, sir.
Yes, very true. Yes, very true. Very true. Yes, yes, very, very true. You very rightly say that we must avoid certain words. That is very, very important. So anyway, thank you.